infrastructure in order to get this kind of data. We need action. We need commitment from city governments, but also from practitioners. There was something really interesting in the chat that talked about what are our individual actions that we can take. So in order to address some of those questions and in order to discuss a little further on what are some practical solutions, really building on the first session, I'd like to invite our next speakers, which is the first person that I'd like to invite is Pallavi. I know you just shared a link in the chat too. So Pallavi Pant, she's a scientist at Health Effects Institute, and her team has actually been working and has released this really interesting report on global status of air. And I think this is one of the first reports that touches on the impact on babies and pregnant women, and how poor air quality impacts them. So Pallavi, really excited to have you and your your lens from the science, but also you've been working a lot with advocates and really trying to bridge this gap between science and advocacy. So we're really excited to hear from you. We've got Iyad Kheirbek, who's the director of air quality program at C40. He's worked in the New York City government, but he's also worked across cities. So we're really hoping, Iyad, you'll bring in what cities are doing, what are some solutions that cities are applying, but also what are the challenges in actually getting these solutions implemented. And finally, I'm really excited to also have the mayor of Renca, Claudio Castro, with us. Mayor Claudio, I was so impressed to learn that you actually won the election in 2016 by 92% majority. I don't know how politicians can do that, so maybe you can share some tips with the inspiring politicians here in our team. But I think for me, what's been really amazing is the Aeros Novas project that you've been doing, and how it really focuses on children. So I think that's something very exciting for us to understand, that from the political side, how do you really convert this action and then that will into action? So with that, maybe if we can get started, Pallavi, Iyad, and Claudio, if you can just briefly share a little bit about your work from your own words in air quality, and what are the trends that you have seen specifically when it comes to air quality and actions for young children and babies and toddlers. So maybe Pallavi, if you can start, and then Mayor Claudio, and then maybe Iyad, you can talk a little bit more on the broader city side. So Pallavi, to you.
Thank you, Ankita, and thanks first of all for having us here and letting us engage with a very wide diversity of groups and individuals from across the world. Our institution, which is the Health Effects Institute, is based in Boston in the US. We're also experiencing pretty good air quality today because we had a lot of rain over the last 12 hours or so. And our organization has focused on research questions related to air pollution and health for the last 4 decades. Most of our work used to focus primarily on North America and parts of Europe, looking at policy relevant science that can help us improve air quality. And over time, we recognize that across the world, we have the problem of air pollution. It's impacting people's health. So for the last 5 years, in collaboration with the Institute for Health Metrics and Evaluation, we have also been producing an annual report, which is called the State of Global Air. And we provide trends on both air quality and health for countries around the world. So you can look up how your country is doing, how the health is getting impacted by different levels of PM2.5 and ozone. As Ankita was just talking about some of these pollutants. And what we are finding, we have a huge health burden on people around the world, but children in particular bear a big proportion of this burden. Just last year, our assessment included for the first time global estimates on the impact on newborns, so what's happening to the children as they are born into the world. And we found that more than 500,000 infants died in the first month of their life because of air pollution exposures that their mothers had during pregnancy. So this has huge implications for how we think about action on clean air and how that's affecting not just us, but also our children and future generations. So I'll stop there for now and maybe pass it on to Iyad.
Well, thank you. First of all, hi to everyone from Renca. We are in the city of Santiago in Chile. And I would like to explain a little bit. Santiago is one of the most polluted cities in Latin America. But Santiago is also a city that has 36 different municipalities within the city. Renca is a borough in the northwest area of Santiago. And because of the geographical conditions, all the pollution comes from the east side of the city, which is also the wealthiest part of the city, to the west, where Renca is, and we are also one of the poorest parts of the city. Renca is a city of 160,000 people, and although we have some national information about the air condition, we don't know specifically how Renca is working on this. So what we started to do 2 years ago was to start to measure, and we installed these like citizen air quality monitors near to the schools, but also we installed some air quality monitors within some houses. We are doing this with the academy, and also in different park areas in the city. And we learned that in this year, we're in the middle of the winter now, and in winter, the pollution is higher than in summer. And I would also like to add that in Renca, we have different industries. For example, even a thermoelectric plant. So we learned that while Santiago had 15 critical days regarding the pollution of the city, in Renca we had 23 critical episodes of air condition quality. So we were not aware of this. Me, myself, I wasn't aware of this. So we started to speak about this. We started to, all this happened in the middle of the pandemic. So it's been difficult to connect that new data with the impact in the children's health because of all the collapse of the health public services. But we are starting to take aware of this. We're starting to a new conversation with the local industries in Renca, with the schools, with the parents also. And now I would say that we are more prepared to take action. So we are learning also about everything that is happening in different cities. I think that they will speak about that. And yeah, I will start with that.
Hi, everybody. Great to meet you all. I'm Iyad Kheirbek. I direct the air quality program at C40 Cities, and thank you for having me today at this really inspiring event. It was really great to hear some of the comments earlier and very inspiring discussion. So I direct an air quality program at the organization C40 Cities. For those of you who don't know who we are, we're a network of mayors that are working together on a climate action and creating healthier cities. Our network is 97 of the world's largest cities, accounting for about 25% of GDP. And so we aim to be a leadership network of cities really taking leading action on climate and air pollution and healthy cities. And we're led by the cities themselves. We're governed by a steering committee of 17 mayors, and our current chair is the mayor of Los Angeles, Eric Garcetti. And so within our network, we estimate about 95% of the population of C40 cities live in areas that exceed the World Health Organization guidelines for PM 2.5. And we know that many of the most populated cities are in parts of the world that are the most polluted. Almost a third of the population of C40 cities live in areas that exceed 5 times the World Health Organization guidelines. So this is a really important issue for our mayors and an important concern for citizens. But we also know that's a pretty incomplete picture. And we heard earlier from Carlos and others about the lack of data and the lack of awareness in many places. We know that there's been research that more than half of countries don't even have any PM 2.5 monitors, when we know this is one of the most toxic air pollutants that humans are exposed to. And this this lack of monitoring is particularly bad. There's some research that was done by the UN, I believe, that said only 6% of children in Africa live within 50 kilometers of an air monitoring station, compared to 70% in North America and Europe. So the lack of air pollution monitoring and the lack of awareness and the data availability for folks to empower themselves to protect themselves from air pollution is a significant issue, and one that we're trying to address through our work. Quickly, our work at C40 is we aim to work with cities at both the political level and the technical levels. We want to work with mayors to make ambitious commitments on meeting air pollution targets and implementing locally relevant solutions to air quality, while then supporting the technical staff within cities towards meeting those commitments. We do a lot of work around capacity building and air quality management. We do a lot of work on air pollution monitoring and in supporting of implementation of solutions. Some of our work, just to highlight a little bit, we maintain networks of experts, of air quality managers within cities to share knowledge and scale best solutions. We have projects that support an air quality management planning and air pollution monitoring in places like the Philippines, in Ethiopia, in Los Angeles, in the United States. And then one of the key pieces of our work is thinking about how do we integrate climate action with air pollution, recognizing there's win-win solutions for both air pollution and climate. And if we think of these things in silos, we could end up with unintended consequences or inefficient planning. And so we work with cities to try to align that type of work. I'll stop there just about our work, but I could talk more about what's happening in our cities and success stories throughout the session. Thank you for having me.
Thanks, Iyad. So I'll kick us off with and it's kind of interesting that, you know, we kind of touch on monitoring. This was something that also came up in the first session that we had, that we do need to monitor. It's interesting, Mayor Claudio, you mentioned the actually installations of air quality monitors within the municipality of Renca. But maybe Pallavi, I can start with you, especially the report and this number of 500 infants that die every year. If you could talk a little bit about how do you really, I mean, and I also know you come from a background with advocacy and bringing in the science together. How would you see, and if we kind of explore a little bit more on the theme of monitoring, how can we really integrate this clean air agenda with the early years action that are happening at a city level? And what are some ways that we can actually even advocate further for getting the monitoring system set up? And maybe once you start with that, I'm curious with you, Iyad, to mention a little bit about what does it take to really get these monitoring systems set up, and what are the challenges? And then maybe, Mayor Claudio, you can talk a little bit about what it took for you to really get this done. So Iyad, Pallavi, and then Iyad, and then Mayor Castro.
Yeah, actually, I'm really glad that even in the previous session, the issue of air quality monitoring was brought up. And, you know, Iyad sort of reinforced that a little bit here, because when we start thinking about the health effects of air pollution, almost the first point of entry is understanding what levels of air pollution we have around us. And over the last 2 or 3 decades, we have been, you know, collecting evidence on how air pollution is affecting the health of children and adults in different parts of the world. But because we haven't had enough information from countries where the exposure levels tend to be highest, even right now, when we did this interactive exercise, we saw levels in Europe and the US cities were much lower than what we saw for, you know, cities in Latin America or cities in Asia. And unfortunately, those can sometimes be the places where we lack the data on air quality. So our understanding is not as good in terms of what we are even getting exposed to. And that can mean sometimes that our, you know, predictions for how air pollution is affecting health, you know, can vary a little bit. So you might be able to say with some confidence that there's, you know, X number of deaths in infants. But in order to be really confident in that data, we need better air quality monitoring systems. Fortunately, over the last several years, as we've made sort of technological advances, we have been able to utilize both satellite data, so what we are measuring from above, you know, above us in the skies, and incorporate that into our understanding of where and what kinds of air pollution levels we see in different parts of the world. And as was also mentioned in the previous session, utilizing low-cost sensors, which are often relatively cheaper, relatively easy to install, and can provide data that can engage people at a very personal level. If I'm able to see what the air pollution levels are, what the PM 2.5 levels are in my home or in my neighborhood, that connects me better to this information rather than an abstract number that might have been collected kilometers away from where I live. So in understanding the health impacts of air pollution, especially in children, we often do rely primarily on what we know about the air quality around them in their homes, in their school, in their parks, or wherever they're interacting with the world around them. And then capitalizing that and sort of leveraging our decades of knowledge on how air pollution affects health to then say, 500,000 infants around the world are getting affected by air pollution in just 1 year. And this is only infants. When we start thinking about children under 5, which is sort of what we are focusing on here, that number can go up even higher in some countries and in some regions. And worldwide, for children under 5, almost 10 to 15% of all deaths in children under 5 can be related to air pollution. And it can be either because of outdoor air pollution, where sources like transportation and waste burning, which someone mentioned in the chat, can be very relevant in urban centers. So that can be a place for us to begin thinking about better monitoring and also trying to use this very powerful information to influence policy action and to motivate motivate and engage the public to demand better monitoring and better action thereafter. Over to you, Iyad.
Thanks, Pallavi. And Pallavi actually put it so well. I don't have too much to add on the value and importance of air pollution monitoring. But you asked about sort of some of the challenges and thinking about how we collect data and use it. I mean, obviously, one of the challenges is cost, which is always an issue. But I think more so is thinking about how you use the data, how you're collecting. A lot of times when we work with cities, it's more than just deploying air pollution monitors and collecting data, but ensuring that you're using the data and collecting that information so it's fit for a purpose, and that you're thinking throughout a project of why you're collecting the data and how that information is useful. And on the cost issue, Pallavi mentioned there's a lot of new technologies out there like satellite data, low-cost sensors, other types of information that can be used to understand air pollution exposures. And while I think that's incredibly valuable and important in understanding, using some of these new products can fill a really important gap, there's also significant value of engaging with local communities and collecting their own data, as well as in many parts of the world where there isn't monitoring. Collecting air pollution data can be an important entry point to capacity building and air quality management. And so a lot of the work that we've been doing is thinking about how do we use monitoring as really that entry point to air quality management, capacity building in many places that haven't gone down that path. And then the other element of it, so there's two additional elements of it that I think about when it comes to city planning and community engagement. So at a strategic level, I think, and sort of trying to tie this back to the childhood health agenda, I think at a strategic level, it's often important for cities to have metrics of air pollution related health and health outcome metrics that hold them accountable and orient a lot of their work. So let me use as a couple examples. Say in New York City, where I used to work, there was the public health agenda was called Take Care New York. And this public health agenda sets a clear goals for the city on how they develop policies and set their agendas for the agencies. And within that, there's citywide indicators and disparity indicators. Some of those include a section on neighborhood health that include things like air pollution and childhood asthma rates. And the city is continuing to collect that type of data and hold themselves accountable to whether those indicators are improving over time and how the city is implementing the right types of policies to meet those challenges. Similarly, in Los Angeles, through their sustainability plan, there's clear goals and metrics for childhood asthma in the most polluted areas of the city. And that's then orients the policymaking for the city to target interventions in those areas. And the mayor has made it a priority to implement interventions in some low-income neighborhoods of the city that have the worst air pollution and the most vulnerable residents to air pollution, including programs, for example, in the Watts community that include millions of dollars in community revitalization, collecting air pollution data, engaging community members. And then the last piece I'll mention on community engagement, I think the monitoring itself is such an important element to try to get people aware of air pollution. So for example, in Denver, there's a program called Love My Air in Denver, where they put air pollution monitors at schools and have been targeting them in those neighborhoods with the highest asthma rates, and really using that data to start informing their students, informing parents on air pollution levels so that they know how to protect themselves during high air pollution days and during and understanding where air pollution levels are the highest. So it can be an important and have a very important role for that type of engagement and advocacy.
Yeah, I would like to add to that our experience, right? In Chile, I would say that probably this is the same in a lot of other countries. The main public policies related to environment are located in the central government. So while we have risen our collection of data, we have started to challenge different national policies. I will say two examples. One of them is I was telling before about the critical episode dates, right? Those days when we have critical episodes, the national government says, okay, this day industries have to stop, some kind of industry. Or for example, we have to reduce the use of the car in the streets. And a list of different things to do related to these critical episodes. But we learned that we have had in the last year 8 more days of critical episodes, but we didn't know. So we challenged the central government, even when it's not located in the municipal decision to do that things related to industry or with the car, to allow cars to be in the streets. We started to say, okay, we have to consider this new data and what will we do? And if the central government will not do things, well, in the municipal level, we will start to push for that. That is one. Another topic, I said before that we also have started to monitor what happened inside the houses. In Renca, we have very overcrowded houses in the poor areas of our borough. And well, the national housing policy has to consider ventilation, for example. In the nights, it's very the level of concentration of pollution inside the room where children are sleeping is tremendous, and that is because small houses start to make the house to grow, but they don't think on ventilation, but they need more space to live. So we have to consider that in the national housing policy. That is like the central level of the government, right? But then we have also some measures in the municipal level. We have started to incorporate in our urban planning, well, how we reduce the mobilization or the journeys within the city. So, for example, how we connect children living close to their schools, that they don't have to go to a school that is far away from the house, so they can go close to the house. How we have a rise in the inspection, for example, in the cars around the schools. So we, we realized that the school transport, when they go and leave the children in the school, they leave the motor on for a long time. So we have started to inspect and we say, okay, you have to leave it's not the motor. How do you say do you understand if I say motor?
Yes, you don't leave it in idle.
The engine.
Yes, the engine.
The engine of the car. You can only leave it on for just 5 minutes, no more. If you will stay more than 5 minutes outside the school, you have to turn off the engine of the car. So different measures like that. And also we are thinking on this, on using more open spaces related to a school. Also in Renca, we have a very nice hill, but the hill was very low used. So we are connecting some classes to the hill, so even time more students go to the hill and have classes on the hill, and that is also like help to create more secure environments for children.
Thank you, Claudio. And I think you also have a little fan group in the chat who's congratulating you on the Air as Novice project. And you know, you kind of touched on the next part that I was going to bring up, because from what I'm understanding, and Iyad and Pallavi, you touched on the monitoring aspect. And for me, I think monitoring is the fastest action that we need to take. We need to start monitoring in order to then understand where we stand. But for me, what I'm curious on, and you know, very nicely put, Claudio, is that, you know, we need some short-term and quick actions, but we also need to think of long-term actions. We need to think of quick solutions, and we need to think of long-term solutions. And it seems like Renca is already kind of leading the way with the thinking of, on, you know, from mobility to the journeys that children are making to like where do they actually study, and like in cases where pollution levels are high, there's like an immediate action that can be taken. So maybe we can start to turn and you know, as the groundwork's been laid by Mayor Claudio, we can start to talk a little bit about the actions that we are seeing, and what's the balance between the short-term and the long-term solutions, long-term and short-term actions. I see Dr. Prashant is here from the University of Surrey, who's done some really interesting work on short-term and long-term solutions. So maybe, and I see you've already shared some links, so I do encourage others to check those resources out. But Pallavi and Iyad, if you can talk a little bit about that, and then I will ask, you know, Mayor Claudio, for you to then take us to the next step, which is like, how do you convince politicians and mayors to take that action? What convinced you, and what would you tell other mayors to do? So maybe Pallavi and Iyad on the solutions, and then on the politics with Mayor Claudio.
Yeah, I think, you know, what I'd maybe start with is that although we're, you know, talking a lot about improving and expanding air quality monitoring, and it is really critical, there are things that could be done today to start improving the air, even if those air quality monitoring systems take us, you know, 6 months, 10 months, 2 years to really put in place and learn from. Because the understanding that air pollution is affecting the health of children on an everyday basis, especially in places, you know, where the ambient air pollution levels tend to be very high, is very robust and is based on evidence from all over the world for a very long time. So I wouldn't not act just because I don't know what the air quality levels are in my city. Having said that, there's, you know, definitely also this understanding and sort of perspective from the last few decades that cleaning up the air will require us to take very sustained action over time. And, you know, acknowledging that we may not be able to make it go from gray skies to blue skies in 1 year or 2 years, that's going to take a longer time. And in that context, in the long term, focusing on major sources that are affecting the air quality at the local level, but also at the regional level. I think this was mentioned again in the previous session, that air pollution isn't just about one city or one borough or, you know, one country. We often have air pollution traveling from country to country or region to region. So thinking about both very local action at the neighborhood scale, at the city scale, in terms of controlling or reducing pollution levels. Mayor, you know, mentioned a little bit about the buses that don't, or like other vehicles that don't turn off the engines. In India, in many cities, we've seen the same issue where parents or, you know, someone's coming to drop the kids off at the school, and then they're walking the last 50 or 100 meters where there's 50 cars just, you know, idling, and children are getting exposed to that air pollution. So very quick action in that case is trying to make sure you know, avoid that from happening, make sort of better awareness for both schools and parents so that they understand why this is detrimental to their children in some ways. And then in the longer run, thinking about the solution where cars can be replaced where possible by public transportation. Can children walk to school? Or can they bike to school? Is it safe for them to do that? Is it easy for them to do that? So trying to prioritize actions that would have very immediate impacts in terms of reducing exposures, and then thinking of the long-term actions as ways to address the sources and emissions. So transportation, waste burning, which tends to be a big problem in many urban areas around the world, and then thinking more broadly about how we really engage with the spaces around us and how we can reduce exposures overall would be a good place for us to start. But again, I would reiterate that action can begin today, even if we don't have very granular information on our air quality and exposure levels.
Yeah, I mean, again, I think that was very well put on what needs to be done, and I would fully agree. I don't think there's anywhere on Earth right now that we don't have enough information to start taking action and start implementing solutions on the sources that we know are polluting. Sure, combustion of fossil fuels, burning things causes air pollution, right? We know how to address these things, and we don't need extensive amounts of data to do that. But following up on what Pallavi was saying, I mean, when we think about how do you address air pollution in cities, there's the sort of foundational things that need to be done both at a federal, state, and local level, and understanding who's responsible for which sources of pollution. And in most parts of the world where you've seen large improvements in urban areas, it's come from that multi-level action that's addressed air quality. So where I live in the United States, we have a Clean Air Act that over time has strengthened, and as a result, it's led to tighter controls on emissions from power plants, controls on industrial sources and downwind sources, agreements between states to address sources of pollution outside of their boundaries, and thinking of air pollution at an airshed level of what are the sources, who's responsible for them, and how do you address them. And that can lead to the largest amounts of air pollution treatment that affect citywide air pollution levels. And then within the cities, it's thinking about where are the disparities in air pollution exposures, where are the hotspots, and how do we address those hotspots with locally relevant solutions. And one of the things we try to do a lot of thinking about is what are the solutions that provide these multiple benefits for both citywide air quality, for climate benefits, and for eliminating the disparities in air pollution exposures that we've seen historically over long periods of time. And then getting back to maybe the childhood health discussion, when we're thinking about sort of some of these localized types of strategies. So trying to mitigate air pollution among children and at schools, that's been people have been thinking about that for some time. So for example, in California, there's zoning policy around where you can put schools, that they can't be sited within 500 meters of a major highway. And then there's, often, unfortunately, exemptions associated with that, which is a separate issue. And then US EPA, for example, sets guidelines around siting schools near high traffic areas. But we know that's not enough. And so there's a lot of people that are now looking at these interventions like school streets. And so, for example, London has implemented, I think, nearly 400 school streets over the past year or so, and has already identified significant NO2 reductions during peak periods, during drop-off times. We've seen similar programs in Vancouver and in Barcelona, where they're trying to look at what are some interventions to mitigate emissions near schools. But I think what we want to think more broadly about is how do we connect this type of smaller scale implementation work to larger scale policy interventions. And in terms of some of the trends we've seen, which I think is exciting, is seeing in some cities where now planning decisions, transportation planning decisions are starting to move to public health departments, where you're seeing urban planners and transportation planners working in public health departments and really starting to think about what are the determinants of health, particularly in the built environment, and how can you adjust those to improve the health outcomes that we were talking about earlier the call or in the meeting. And so thinking about how do you make those connections where often the public health department are the people that are closest to the communities. There's community health centers, there's physicians, other folks that work in health departments who work directly with communities. How do you connect things that happen more on urban planning and environment to that work that's happening in the health department? And I think that can lead to longer term sustained change.
Well, while I would say that nowadays every politician has a very rise or big awareness about climate change, I would say that I wasn't making the connection between climate change or air pollution specifically and the health of children. So for me, it was, you asked me, what convinced me? What convinced me was this regional network that was installed by the Bernard Van Leer Foundation and in Chile with Horizonte Ciudadano, which is a specific foundation here. And they gathered different leaders all over Latin America, and they told us, okay, you have to be aware of this. Climate change and air pollution has impact, especially in children. So what will you do? That was a very big question, and they have helped us to gather data. I would say the data it's very important. We were not seeing this impact, and once we started to see, we knew that it was much more big topic than what we were even prepared to be aware of. As Iyad said, we started to change our conversation. The teams in our municipality that were related to the environment had never spoken before, for example, with the medical teams within the public health services. And we started to connect those dots. And we started to tell the medical teams, were you aware that in Renca, we have more critical episodes, that it has a more specific impact in children. You have to use this new information when you receive a toddler children in a public health service. And also, I would say that we need to connect this in a more global aspect. No, we in Renca, after all these things that have been happening, we are the first city. I told you that it's not a city, it's a borough within a city in the city of Santiago, but we are the first subnational government in Chile that added to the Race to Zero challenge. So we now have to connect waste, energy, air pollution, green areas, reforestation, and all these things that are happening in our area of the city, the area that we manage. And we have to bring here to this conversation to the private sector, the central government, the regional government, but not to think about this topic like in Chile, but to think it in the 23 square kilometers that are in Renca and how we will connect all these different actions in this piece of the territory. So it definitely have changed our way to address this challenge, and we're very committed to keep working very hard to address this.
Thank you so much. And I think what's interesting is that this has really tied it up. And I think Iyad, you mentioned school streets, which has become a trend. And I'm always curious, specifically when we're talking about babies and toddlers, like it also expands to daycares, it expands to hospitals. We're talking about the health sector. There's a question around when you go to the hospital, are you exposed to bad air? And that's like defeating the purpose of even like understanding your health. So there's all those impacts. Of course, parks and public places where you actually spend a lot of time. And JP shared some of the campaign of really encouraging children to be outside. So I think Mayor Claudio, you've really touched on the multisectoral approach. And I think what's interesting is that instead of always just thinking about that bigger picture, also starting to think of the neighborhoods that was touched in, or like, your smaller area, what's possible to do. So I think there's a lot in this discussion that is really exciting to understand on the actions that are being taken, but also movements, whether it's starting with the school streets. Can we start to expand further and really think of a more holistic approach in neighborhoods and really increasing the scale on where that action's taking place? I do recognize that we're at time, but there are a few questions in the chat. So maybe we'll take there's one specifically for you, Iyad, if you want to take, and maybe Pallavi and Mayor Claudio, you can touch on this too, which is there a social justice issue where improvements tend to be quicker and more comprehensive? And I think Mayor Claudio, you mentioned that too in your right, like there is certain areas where because of the marginalization, there's a different action. So if that is there, and I think Carlos Dora had mentioned a little bit about the affluent and the movements in the advocacy. So I'm curious if each of you can probably just end on a comment on bringing it back to action, and how do you really bring young kids that are at disadvantage in the front, and does advocacy always have to be by the affluent, and really thinking of a more comprehensive and quicker actions for those that are marginalized?
Yeah, I mean, I can start from the city policy side. I think that designing equitable policies isn't, it doesn't come naturally. You need to be very deliberate in how you're designing your policies and making your investments to ensure that you're mitigating disparities within cities and disparate exposures. And so really thinking about A, understanding what those disparities are, and B, ensuring that the investments you're making are going not only to address overall air pollution levels, but those impacts in those communities. But also thinking about, again, I mentioned previously, the sort of intersectoral nature of things, and how, for example, if you're looking at a climate policy around energy efficiency in buildings, for example, right? You might think about that being just a citywide policy, building codes on energy efficiency. But how can that mitigate inequities within cities, where we know some of the highest asthma rates within cities among children are due to indoor air pollution exposures, mold, built environment quality. And so interventions to improve energy efficiency in those buildings can have significant local impact and can produce local jobs in those neighborhoods, green jobs in those neighborhoods. And so there's these wide-ranging benefits for taking those investments in disadvantaged areas of the city and then making that case that why those investments matter in that part of the city. But really, I think it also takes leaders, like we heard Mayor Castro say earlier, leaders to really prioritize solving inequities within cities as one of their main priorities, and then thinking about how does the policies they put forward help meet those goals.
Thanks, Iyad. Pallavi, do you want to go next, and then we can hear the last words from Mayor Claudio?
Sure. I think, I'm going to sort of do what Iyad has been doing, and essentially he sort of touched on most of the aspects that are really relevant. I'll maybe give a very quick example from, other parts of the world. So in India, there is a growing movement within the not very affluent groups, especially waste pickers have been very active in demanding clean air and, better access to healthcare and other types of issues. So they're thinking about ways to integrate and find intersections of different, major social justice issues or environmental issues, and then looking at very collaborative campaigns and work from different types of partners, something that we are trying out a little bit here. Because also what we've seen, again, I'll give an Indian example, is that when the push for clean air is coming primarily from the affluent class, it's often not taken into consideration as seriously, because it's seen as just, another thing that the rich now want. But when it starts to come from people who are, really getting affected by it on a daily basis, then it brings a different force with it. So identifying who those communities can be and equipping them with the right information. Mayor Castro sort of said, when you get the data and the stories together, you realize what a big impact that can have. So trying to identify those intersections, equipping communities that can then demand for change, and helping that lead the way for better policies could be a place to start.
Thank you, Pallavi.
Yeah, I would add to that at the end of 2019 in Chile, we had very important social outbreaks related to inequalities, the same that in every country, I would say, in the world. And people went out to streets mobilizing because of education, health, retirements, and we have learned that when we speak about climate change and environmental topics, they also affect differently people related with their wealth. And in Chile, that happens also. So we have to connect also the environmental action with the inequalities that we face every day. And I would say that at the first, Amica, you asked how can a mayor be re-elected with a 92%? I would say in a democracy, a decent democracy, I would say. I would say that the answer to that is that the community has to be the protagonist of all the transformations that we are doing in our area, in the city that we are managing. And in climate action, that has to be in the same way. So data helps politicians to be aware and take action, but more important than that, data has to increase the awareness of the community, and the community needs to know that even when everyone says that, okay, who has to do more related to the environment are probably the biggest countries and the biggest industries, but we also have to change, and we can change with very specific actions. And it's much more important when we think that every action will have a much more impact in the children, in our children, that we have to protect. And I would say that is the key to advance in this matter.
Thank you, Mayor Castro. And I don't think I could have summed it up any better, but I will just say like three or four takeaway words for me is this is multisectoral. Community, of course, you mentioned that the community has to be the protagonist, but it also seems that you need great leaders to actually take that policy forward. So it's actually every level of society that needs to work towards this issue. And thank you for pointing out data, because I think that's something that really ties to our next segment of what we're trying to do and actions that we're trying to take. So I want to thank you once again, Pallavi, Iyad, and Mayor Claudio for such an enlightening and rich discussion. I think this has really been amazing. And I'm sure the audience might have more questions for you, so please feel free to answer them in the chat. And thank you once again for joining us.